So another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Now, hypertension, also known as the silent killer, is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. It's one of the major causes leading to heart attacks, heart failure, stroke, collectively known as cardiovascular diseases, and chronic kidney damage. Controlling hypertension is important to prevent lifelong complications and acute cardiovascular events. Hypertension is known to be the single most important leading cause of early deaths due to cardiovascular diseases. Now, according to WHO Global Report on Hypertension in 2023, estimated that the number of hypertensive adults almost doubled globally during the last 3 decades, from 650 million in 1990 to 1.3 billion adults by 2019. The health impact of increasing trends of high blood pressure translated to 10.8 million avoidable deaths annually and 235 million years of life lost or lived with disability. Can you imagine that? Now, the theme for World Hypertension Day this year says, measure your blood pressure accurately, control it, and live longer. The burning question is, do you know when and how to measure your blood pressure to ensure your safety and live longer? If your answer is no, then you're right on time to know more. And if your answer is yes, you're still welcome on board to uncover even more than you already know. On Healthy Living today, we have a medical physiologist, Dr. Grace Okwa Ogilegwu, to help us shed light on those burning questions on your mind. Stick around. Once again, Grace, how are you doing today?
I'm so fine. How about you, ma'am?
Great, thank you. You look great, by the way.
Thank you so much. You too.
All right, because we're talking about hypertension today, especially understanding what it really is, could you please let's start from the top by shedding light on what hypertension is?
Okay. Okay. Before I even go into the definition, hypertension is the major concern that's public health in Nigeria, not just the word alone. I think last week was the World Hypertension Day. I don't know if you're aware about it. Okay, and so it is a major concern because of its complication. It can project if it's not well managed or controlled. And it's just so pathetic. There are other 1 and 3 in Nigeria where they even have this. Exactly. And so that is why the education is so important. And just so happy that you're bringing it up so that a lot of persons can learn from this. And so when you talk about hypertension, it's just a name. Like it's just a name, but very, very easy. It says an elevated blood pressure. But just like what you said, for others to understand it, we need to know what blood pressure is. Of course. Because for you to know what hypertension is, you should be so conversant with what blood pressure is. And blood pressure, when we talk about blood pressure, so it's just the force or the pressure of blood that flows through the walls of your arteries. Just like, we have the chambers of the heart, the atrium, the ventricle. So when the heart contracts, that's the ventricle, when it's contracts, it pushes blood into the walls of the artery. So at that point, the force of blood, the force of pressure within the walls of the arteries, that is what we call blood pressure. And if you, of course, you've gone to check your blood pressure once sometime, you discover that there are 2 figures.
Yeah, one up top and one
down. Yeah, yes. So for the up one, we call it systolic. So it is when the blood, when the ventricles, when it pushes the blood into the arteries. Okay, the first figure there, the pressure there is what we call the systolic, and it's always higher.
Okay, yeah, that's
true.
I
don't know if you're
almost looking like an improper fraction.
Yes. Then for the downward figure, which is the diastolic, it is when the heart relaxes to receive blood. So there's a contraction and there's a relaxation that happens. So during the contraction, the ventricle is pushing the blood into the artery. So during the relaxation, it's taking back the blood, and that's why you see that the pressure are quite different. So that's what, then when you understand what blood pressure is, so hypertension is just an elevated blood pressure. When the force of pressure within the walls of the arteries is consistently high than the normal value, because you have a normal value. So when it is beyond the normal value for every individual, that is when we consider it as hypertension. And there are stages. You cannot just say, okay, this person's hypertensive just because you checked. Once there are stages in hypertension, we have what we call the elevated blood pressure. At this point, it's not hypertension, yes, it is called elevated. The reason why I'm sharing this, because for most people, when they go to the hospital and they discover that they have elevated
They still call it hypertension.
Yeah, they still call it hypertension. And not just that, they don't really care about it. They feel like it is not high, so I don't need to do anything about that. Yeah. But having elevated hypertension puts you at the risk of having the other hypertension. So you can go to, you know, the normal blood pressure value is 120/80. So you can go to the hospital, you check, and you'll be having something like 120 to 129. That is what we call elevated over 80 to 89.
Okay, wait. 120/129. I was going to ask you, is there ever a situation where the lower one, the diastolic, like you called it, right, can ever be higher than the systolic?
Yeah, in most cases.
Wow, it happens?
Yes, it happens in most cases when there are other issues.
Okay, so is that the example of the elevated?
No, that's not the example of the elevated. The elevated is just still within the normal range. Just like the normal value is 120/80.
80, yes.
So when we speak about the elevated, we are going into either 128, 129/89.
Okay.
So it's way beyond the normal values. I don't know if you're
Yes,
together.
I understand. Now that's like 9 ahead, 9 ahead on
downward
both sides,
and upward. So that's what we call elevated. And at this point, you're not hypertensive, but you are at the risk if it's not well managed. And so a lot of persons don't know this. They feel like since it's just within that range, I am okay, I am fine, I can live my life.
It looks like very normal. Like it's not just 8 sides on top, so no big deal.
Yes, I understand, but it is not normal. And this has put a lot of people at risk because they feel like it is normal, but it is not. It is what we call pre-hypertension or elevated. But in this case, you don't need medication.
Okay.
All we suggest you to have a healthy lifestyle. But if after a month and you return, and we discover, okay, the blood pressure is between 130, that's 130 to 139/80 to 89. That is what we call stage 1 hypertension.
Oh.
Yeah. So we have the elevated, we have stage 1.
Stage 1.
So stage 1 is after the elevated, when it is not well managed.
Okay, let me get something straight.
Okay.
So that viewers can understand and I can understand as well. So the first stage at 120 to 80, that I know that's not categorized as a stage. 120 to 80, what is that called?
That is the normal value.
That's the normal
120/80.
That's normal value for blood pressure.
Yes.
So when it becomes 128, for example, to 89, that's when it is called like elevated or the
blood pressure
pre-stage.
or the pre-stage.
And then
yeah.
Okay.
So at that stage, that is when you're at risk of developing the red stages if it's not well managed.
Okay.
So then we have the stage 1 hypertension. That is where the hypertension starts from. That is when the previous elevated one is not well managed. And at this time, we are having figure of 130 to 139/80 to 90.
Wow.
Yeah. So at this stage, it's called stage 1 hypertension. It is now beyond the normal.
Of course.
Yeah. So at this stage, what is required? Healthy lifestyle is not okay. There have to be medication.
Okay, once it says from 130
upward, there have to be medication. Then we now have stage 2. At this point, the blood pressure is reading from 140 upward.
Wow.
At this point, you're at risk of any cardiovascular diseases like heart failure, stroke, heart attack. It can even damage some of your organs. So that is what we call stage 2 hypertension. Then for the stage 3, at that point, it's from 180 and at that point, it's called emergency, hypertension emergency. If
so people get to that kind of stage?
They have patients.
Wow.
On that stage, yes.
So now I'm beginning to wonder, because people often look at hypertension as a very normal thing. In fact, before now, if you didn't clear this for us to understand, we used to think, oh, once you've hit 120, you are hypertensive already. At least now we get to understand that, oh, there are stages to this hypertension, that stage 1, stage 2, and very likely stage 3. But people often also ignore it because they don't see it as a big deal. Now, we know it, and it's been described as a silent disease, a silent killer. And they say it occurs in 3 patients. When you find 3 people in a room, know that one of them is very likely hypertensive, which is very true. Now, is it possible that, is it because of its asymptomatic nature that has made it become a health challenge that is becoming rampant every day, that people care little about?
Just like, let me pick from what you said initially. Well, it is not that the reason why it is rampant, I think it's because people are not educated about it, and people don't really know much about it. People might say they know more, but they don't know. That is the problem, and that is why it is increasing every time, because a lot of people don't know about this. There are a lot of misconception. That is why it is increasing every day. And from what you said, the reason why it is a silent killer, it is because it doesn't present any symptoms. And that's why you see that it is just everywhere, because before people get to know about it, at that point they are hitting 150, 170, 180. Some persons might, because you can even have hypertension, you can be hypertensive for over a year, you might not even know. That is how dangerous it is. That is why its called is silent killer. And it can be killing you gradually, you still not be aware of. The only time when you come up with symptoms is when you're hitting 180. And at that point, that is when we call it is emergency
state.
A stage already. And that's why you see that it is just everywhere, because people are not aware. Because you cannot look at this person and say this person is hypertensive. You have to go for checkup, routine checkup and all. So the reason why it is just so rampant is because people still don't know about it. That's why it is only when it gets to a very high stage, that's why a lot of people come to the knowing. So yes.
So let's talk about some of the causes of hypertension.
Okay.
What are the causes that we can pinpoint that could, make people become prone to hypertension?
Okay. Before we discuss about the causes, because there are two types of hypertension.
Okay.
So understanding the two types will help you know the causes.
Okay.
We have the first one, which is the primary hypertension. It is very common. Like a lot of persons are likely to develop that.
Oh.
Yes, and it is idiopathic. Why? Because it doesn't have a known cause.
Wow.
There have been so many studies that have been going on, but we've not come to, we can't say this is the cause. This is the cause. But there are a lot of things that put people at risk factors. You can be at a risk for a lot of things that can put you in that line for the primary hypertension. So now we're talking about the cause for the primary hypertension, though there is no cause. But so many things can put you
at risk.
And one is lifestyle, that taking so much intake of salt. People like consuming processed food, canned food. Don't know that you're putting yourself out there for essential.
Some persons would even put extra salt in their meal.
Very dangerous. That after even cooking it, you still say.
And there are some meals that people naturally eat with salt. I'm trying to remember. Some persons will buy pear, and then they'll take it with extra salt. Some persons will buy quite a number of things that people eat with extra salt. I remember growing up, my dad would always have on the dining table. He would always tell us, put a can of salt on the table in case your taste bud wants extra salt. You can just add it to your food. And
that's very dangerous. That can put you at a risk of developing essential hypertension. That's why you see that there's always don't take so much salt, because when you take so much intake of salt, it helps the body to retain more water. And when there's a high water volume in your body, there's a likelihood that your blood pressure will increase. And that is what salt does too. And also obesity. Too much weight can put you at a risk of developing essential hypertension. Yes, becoming so, because the normal weight for a healthy individual should be around 20. That's your normal BMI.
Yes.
So when you're reaching like 30, 25 upward, you're already obese. Like that is what we call obesity. Okay. So when you are overly weight.
Now I'm looking at this value. If you're going to calculate it in terms of maybe pounds or how best do we break that down so viewers at home understand?
Okay, like if you want to get your BMI value, first of all, it is your height, your weight all over your height in square. That's you can check your weight in kilogram, then your height, because most of the times height comes in centimeters. Yes. So it's just for you to divide it, your height over your weight and get your figure.
Oh, okay.
Yeah, it's not so hard. It's just so simple that anywhere you go to, they can help you. Even at home, you can calculate it. So you can know if you're obese, because there are some persons that they might not look so big, but they can have a fat around.
That's
and
true.
That can put you at risk of becoming obese too. So regular checkup will help. And also another thing is high intake of alcohol. people that love drinking.
Okay, well, people are listening. People that like to drink.
High intake of, people want to just relax, but you don't know that you're putting yourself at risk. Yes, when you consume so much alcohol, people want to get relief, but in that getting relief, you're putting yourself at risk, because high consumption of alcohol can also put you at risk of developing essential hypertension and limited exercise. People that don't go for exercise, so you're likely to have essential hypertension. That's why we always go for exercise. We're not asking you to go to the gym, but at least just do one to exercise.
These days are kind of lifestyle, truly.
Yes, and the food we eat that contains so many saturated, always feeding on cheese, on this, on canned food, and all these things can put us at risk of developing, essential, having to grab one pizza, grab one this, burger.
I am so guilty.
You want to eat shawarma and all this. All this can put us at risk of developing the essential hypertension. That's what they're saying. It doesn't have a known cause, but when you're living this lifestyle, you can.
Risk factors.
Yes, you can. When you have this fact, you can put you at risk of developing that essential hypertension. That's why it is very common, and that people are not even aware, and again, genetic, so can put you at risk.
For essential.
Yes.
Wow.
Maybe there's a family member that has it, you're likely to develop it. That's why when you know your history, you should know what you do with your lifestyle.
Of course.
So you don't go do what other people are doing. A lot of persons might even take this, it might not affect them, but since it's in the gene, it is genetic, there's a likelihood that you might have it, and that's why preventive measure has to be there so that you don't come into it. And so that's for the essential hypertension. It's so common, it's very common, and people don't even know they have this. They're just living their life, and it's just so pathetic that you just become one, and this person fainted, this person did this person has
this person slumped and died or something.
Because it doesn't present any symptoms. And then we have the secondary hypertension, which is also common, but the reason why it's called secondary, it is because it has a secondary cause.
Okay.
Yes, so this has a cause. For the essential, it doesn't have a cause.
It doesn't have a cause. It just has risk factors.
It just have risk factors, but for the secondary, it has a cause.
Okay.
And there's people with kidney diseases. You're likely to develop secondary hypertension. People with diabetes,
yes, I think
you're
I've heard
likely
of that.
to. People with hormonal imbalance too, you're likely to develop this secondary hypertension. And people who take medications anyhow without doctor prescription, most of this painkillers, all this, people just, I'm having headache. You're putting it in, but all this can put you at a risk of developing hypertension. That is the secondary hypertension. So it can put you there. So people with all these diseases are likely to develop this. And that's why for secondary hypertension, once you're treating the secondary causes, there's an assurance that your blood pressure is going to come down because it was triggered by something.
True.
Why for the essential, you have to be maybe lifestyle and medication for you to manage and also for you to control it. But though hypertension is not a death sentence, it's just that there are so many misconceptions about it, that once you have it, that is the end. Once you can discover it very early, you can manage it and control it. You will live so better with it. But once you don't manage it or you don't control it, it can put you at a risk of, just like I mentioned earlier, heart failure, stroke, and can damage even part of your organs. And that's why it is so important that we go for regular checkup, because this thing is not written in the face, just
absolutely
like it is not.
Now, talking about going for regular checkups, because just like you said now, a lot of people are at risk of it. In fact, I'm already feeling guilty because I know I eat a lot of other things that you've actually listed.
Okay.
But then I also heard about, I think somebody once said they experience a period-induced hypertension. Is that possible?
Yeah.
I know of pregnancy-induced hypertension.
Yes, that's okay. I didn't even mention that. That falls under the secondary hypertension.
Okay.
When you are pregnant, the whole body system, your body needs so much water because the child also. So there's a likelihood not even your blood pressure increase, everything about you increases once you're pregnant. There's a lot of change that happens.
Everything.
Your weight, you know, when it comes to your respiratory, the way you breathe, the way you eat, you know, when it comes to your GIT, your blood pressure, so everything changed. So for pregnant, people who are pregnant, they're likely to develop the secondary causes. And that's why you see that for some persons, once they're giving birth, the blood pressure go back to normal. Why some persons, they end up becoming hypertensive, which is very sad, but yes. So it can be induced when you go pregnant. Your blood pressure can go up. So it can be well managed.
So what about the period-induced hypertension? Is it possible?
The period?
Yes, that there's something called period-induced hypertension.
Okay. Period-induced hypertension.
Is that possible? I was having a conversation with a lady and she was like, oh, I used to have period-induced hypertension. And I was like, are you sure it's period?
It's period.
Or you may want to really check your lifestyle. She was like, no, it's period-induced. And I said I was going to confirm that when next I have a guest to discuss that with.
Okay, you know the thing about your blood pressure, things can trigger your blood pressure. So even having a pain, just the pain, you know, it can send, you know, the brain does so many work. So when you send a brain, a message to the brain, it can hit one of your hormones. Before you know, there can be so many triggers.
True.
Yeah, just like when you're stressed, you know, they can, you know, in order for your body to be able to cope with it, there are a lot of hormones that's been released that can tamper with it. So of course it is possible. Just like you having anxiety. You know, anxiety can trigger your blood pressure. True. You know, you have you get a very bad message. Before you know, there's a vaso system. Before you know. So it is possible, but it's not something that is to be listed among, you know.
Of course, now I understand.
Yeah.
So this year's theme says, measure your blood pressure accurately, control it, and live longer. And you talked about people going for regular checks. So the question is, how often should we check, and how best should we check? Okay,
how often we should check? At least, and before, that's why it is, if you can get the blood pressure machine at home, it is very good. Even if you can check every day.
Oh.
Yes, it's just so that if you can check weekly or weekends when you are, but at least every week you check your blood pressure. Every week you should, because you don't know what will happen. So every week, when you're less busy, if you don't have it at home, you can come to any nearest pharmacy, hospital. So during the weekend, once you relax, you can come over to check it. But every week you should get your BP checked.
And I heard it's free to check. How true?
I think in the hospital it's free, but I wouldn't tell, because I know there's some persons that have gone to check their blood pressure in some pharmacy store, and they were asked to pay. So I think in some places you pay for it.
Okay, because a community health practitioner once said it's free, always go and check. So I wanted to confirm again.
It's not free. I know of a pharmacy close to my hospital that it is not free.
Wow.
But you can but it is not just that expensive. It's not very expensive. It's something you can pay for. I mean, if it's no matter how much it is, as long as you are helping yourself. Because once you're not hypertensive, the kind of money you spend on your drugs is more than so. No matter how much it costs to check, just put in there.
All right. So we used to know that hypertension, or maybe one of the misconceptions that we know or that people believe in, is that hypertension is meant for older populations, people that are really aged and all of that. But right now, with this kind of examples that you gave for essential hypertension, I'm beginning to think that almost everybody's captured in here. So are there specific age factors that are prone to being at risk of hypertension?
Okay, for the essential, being aged, you're at risk of developing it, because at that point the wall of your arteries is becoming less elastic, to losing the elasticity in it. So at that point it can become weakened. So being aged, from 56 upward, you're likely. But these days we're having people at the age of 30, they're being hypertensive. Why? Because of the other factor. So for the essential, from 30, whatever the age is, you're likely to develop it. Even now we have children who are hypertensive.
Children?
Yeah.
I've never heard that before.
There are cases of children who are hypertensive now because of obesity And also, it is not just, it was before, it was just regarded just to the older population, but these days, well, it's more in the older population. Like, I think in the recent study, 30 to 40% of the older population are hypertensive. But these days, even children have been diagnosed of it. Then we have people who are 30, 35, even 18, 20. Right now, there's no age group for hypertension. There is no. That's for the extension. There is none. Even from the secondary too. Because one of the ways you can even diagnose that you have is secondary hypertension is when, after giving all the medication, you're resistant to medication, and when there's no genetic, when you're not obese, when you're not even, you're living fine and all, and still your blood pressure is very high. So that is what we give. And people who develop this are people from 30 upward. So this days now, there's no age for it. Everybody's at risk.
Okay, so talking about people at risk now, or people who have hypertension, what are some of the first few signs that they may be on the lookout for to tell themselves, I think I'm at a huge risk?
Okay, you know, when we started this conversation initially, we said it's a silent killer.
Yes.
There's no signs or symptoms at the early stage. It's when you're now when you start having hypertensive crisis. That's when you start having headache, you start having blurry vision, you start feeling like fainting and all. So that's why it's killed. That's why it's killing a number of persons. Like, just killed a lot, and it's still killing. Why? Because it's not going to come with any symptoms, and that's why it's very dangerous. There's no symptoms to show. You can just be working and you're hypertensive, you will know. I think there's a patient that was rushed to the clinic. And so after we've managed it, because at that point when he came, he was over 180. At that point he was having headache, he was just so scattered, you know. And well, after we've done with him, then I asked him that when were you diagnosed? He said it was last year, that's over a year, and there was nothing. And because he was told that since there's no symptoms, he's fine. So he didn't go further for it. But it's just a danger, because even if there are no signs, even if there are no symptoms, there are a lot of damages that's going to enter. And that's why the best advice we go for regular checkup. There's no signs to look out for. There's no signs to look out for at all. The only thing you would just have to do to save yourself is just to go for regular blood pressure. And well, yeah.
I know you just talked about, even though there's no sign, it has a lot of damages already doing to the body. Let's talk about the impact of hypertension on the overall health.
Okay. Hypertension has so much impact when it is not being managed or controlled, and one of it is heart failure.
Okay, I know that might be quite broad, but let's go on a quick break. When we return, you'll be able to give us more insight on that.
Okay.
All right, viewers, I'm sure you're enjoying the show. Let's go on a quick break. When we return, Grace will still be speaking with us about the overall impact of hypertension on the health. Stay with us. Discussing understanding hypertension with medical physiologist Grace Ogilegwu. Before we went on the break just now, we're talking about the overall impact of hypertension on the health if not properly managed. Could you please proceed on that? Okay,
there are a lot of damages and also a lot of things that we can come down with if this hypertension is not being managed or controlled. It's not a death sentence, but once it's not managed or controlled, it can kill. And one of the persons we have you at risk of developing heart failure, where at this point your heart cannot reproduce or cannot produce. Why? Because it is not receiving enough blood. So at this point you're likely to have a reduced supply of blood to other organs, because the heart needs I don't want to go so deep in it, but the heart has a supply. So when the wall of the arteries, they are tempered with, there's a likelihood that you have heart failure. And at that point, the blood supply to other organs, it's not there again. So you're even going to be at risk of developing other internal things, just like cases of stroke also. If the brain needs the oxygen. So if there's no oxygen supply in a second, the brain cells goes dead, and once it is dead, you're also dead totally. So once this hypertension is not managed, you're at the verge of developing heart failure, heart attack, stroke.
Wow.
Yes, and also other, even kidney failure, is there at risk of developing diabetes and some other kind of this thing, and the end product can even be death. So there's heart attack there's heart failure, there's stroke, and then there's death.
Wow.
When it is not managed.
You know, while I was doing my research for my introductory aspect of this program, I read that it could also lead to, it's the reason why a lot of people are living with disability today.
Yes.
So when you just talked about stroke, I realized that, it could paralyze somebody.
Yeah, of course.
And that's actually, you know.
Yes, those are the symptoms actually with stroke. You start having a part paralyzed. You might even be lucky that there's some persons that it brings them completely when the stroke happens. The next thing is when there's no emergency, at that point, death becomes the next thing. So that's why you see there's a lot of disability, people coming down with paralysis, fissure, because you can start with, dropping, a face dropping, unable to walk. One side can be lateral and all. So when it is not being managed, these are the things we would see, and that is why it is good we know more about it.
All right, so let's look at treatment options that are available for hypertension. But first, I would like to know, when it comes to treatment, are there segments to the treatment? For instance, the way a child will be treated to the way an adult will be treated, or the way a woman will be treated compared to the way a man will be treated? And are there also situations where, for instance, the ones that probably come from natural causes, like the essential, is treated differently, and the ones that have the secondary causes are actually treated differently? I want to understand this aspect while you try to take us through how treatment is taking place.
The treatment option differs according to the condition. Just like for essential, and that is why I started with the stages of hypertension, because all will be treated with drugs. But when it comes to the elevation, you don't need medication. All you need to is to work on your lifestyle, reduce. So we're going to use for the elevated lifestyle is very important. Reduce the intake of salt, the uptake of alcohol, go for regular exercise, which is most important, and reduce the intake of processed food. Then at that point you don't need this. But when it's now stage 1, at the stage 1 hypertension, you need both lifestyle medication. Yeah.
That's from 128?
From 130.
Okay, 130, okay.
Yes, you need lifestyle and both medication. That is the option treatment for the stage 1 hypertension. But when it comes to that stage 1, the drugs you might be given might not be so much, might just be one class of drugs to be taken, might not be so much, so big and all. But if after taking the medication and it still do not remain at that level, or we are unable to manage it, then that's the stage 2 hypertension. At that point, we're likely to change the medication. Instead of using one class, then you might be you have to combine 2 drugs. Yeah, so for the stage 1 person, your drug uptake will be different from the stage 2. So you might be taking a class of drug, because there are several classes of drugs. So you might be taking maybe calcium beta, you might be taking diuretic, or you might be taking just an hypertensive drugs, one part. Then the person on stage 2 might have to take like 2 combination of drugs. Yeah, it's just like, for the stage 1, you might be given amlodipine, which is a BP medication. But for the person which is in stage 2, amlodipine might not work. There have to be a combination of 2 other drugs. Then for the stage 3 also, you might be given maybe a combination of 3 drugs. So I have patients that we have stage 1 patient, they're just taking 1 combination. Then I have patients who are in stage 2, they're taking 2 combination. Then I have patients who are in stage 3, they're taking 3 combination.
Wow.
Yeah, so your drugs depends on the stages of hypertension you have. So what a stage 1 person is taking, a stage 2 person is not taking.
Cannot take it.
Yes, but the lifestyle still remain the same. You must also go with this healthy lifestyle in order to manage it. But your drugs might differ from the rest. Then for you spoke about children.
Yes.
Most causes of hypertension in children likely to be secondary in a way. So most of the times what they do, because they are children, they will treat the secondary cause. Yeah, so with that way they can help manage the hypertension. Then for those who have secondary hypertension, they're also taking the same drugs. But the thing is that as you're taking their hypertensive drugs, they're also taking their drugs for the other secondary causes, just like a patient that have diabetes and have hypertension. So you're going to take hypertensive drugs and also diabetic drugs in order to control the both of them.
Wow. So there are some misconceptions that I have that I actually put together that I wanted you to counter, because most of the time people just have this idea in their head.
Okay.
I want you to counter them before we talk about management. First of all, people say hypertension, once you start taking drugs for hypertension, you never stop. You take it for life. So let's get your opinion on that.
Yeah. It's so funny. I think that's why a lot of people don't like taking it. I think there's one woman, I said, oh, your blood pressure is very high. What is happening? She said, no, she doesn't want to start. I said, why? That if she starts, she's not going to stop it. And that is why the truth of the matter is what we have for hypertension is management. If you're lucky that the management controls it. But the funny thing is that what controls it is the BP medication. So if you stop it, you're likely to fall back.
So are you agreeing to the fact that once you start, you never get to stop?
You never get to stop.
Okay.
The only thing is that because we have some patient that comes and once they start taking the drugs, it's help manage. It's even make it hypotension. That is a reduced blood pressure. But what we tell them is you can miss it. Instead of you taking it regularly, you can miss the date. But that should be on a doctor. It should be that a medical professional is telling you that. Instead of taking it regularly, a person that comes to me and like, okay, today they are saying 100/80. Like, okay, fine. If it's lower, you can miss your medication. If you see that a week, the drugs, the blood pressure is lower, you can just skip it. But the problem is, because hypertension doesn't have a cure. What is controlling your blood pressure? Because you're having the drugs. Assuming you're not taking the drugs, it will be over highly high. So you stopping it is going to put you at a very risk. We can only tell you to maybe limit the use of it, but not to completely stop it. Wow. Yeah.
I just heard you mention hypotension, and I think someone once said it's even more deadly.
Yeah,
How true?
It says when your blood pressure is very, very low, it says, because, we spoke about supplies of, when we were talking about, hypertension, we mentioned cases like stroke and, when there's no supply to the supply of oxygen to the brain, when there's a reduced flow of blood because of probably and I even mentioned something like high cholesterol, fatty acid, and all, that can actually cause high blood pressure too. So when there's so much pack of cholesterol in the blood, flow, it can even rupture and form blood clots, which can lead to reduced blood supply to the brain, to the oxygen supply to the brain. So imagine having a low blood pressure that is very, very low. Then what we think about it, there'll be reduced supply of blood to your various organ, meaning that there's some part of your body that might not be receiving oxygen it's supposed to be. That means every cells might even die in the body, and that's why it's so dangerous. You can have low blood pressure and you can just faint. I think everyone experienced that, where I just woke up and I think I was doing something. I just noticed I was about to fall. What was happening? I went to check my blood pressure. It was very low. So it is more dangerous because at that point there's no one flow of blood to your organs. Like for hypertension, there's so much blood flowing, but for this, there's a reduced blood flow, so which is very dangerous. I think it will be another discussion another day. Because
I'm already becoming interested, but I think we'll truly leave that for another day. So part of the other misconceptions that people have, they say hypertension can be cured. I know you mentioned that it can be cured, it can only be managed. But some people believe that when they mix some concoction, at home, like some of those things now, it can be cured. So how true is this?
The thing is, all we do is scientific based. Everything we do medically is scientific based. So if after much research and they see that it cannot be cured, fine. If people have cure, the truth of the matter is even the cure, the herbal medication, the concussion people push together and use, they end up destroying other part of your body. So you can even be managing curing your hypertension, whereas you're being predisposed to other sicknesses. So for now, there is always management control. There is no cure for it.
All right. So another person said, if you feel fine, your blood pressure must be normal. How true is that?
If you feel fine.
So long as you don't feel anything in your body, your blood pressure is normal.
That's not true. Because we spoke about essential hypertension. Not even essential, it doesn't present any symptoms.
and another person thinks that hypertension always has noticeable symptoms.
That is when it becomes so high. Or probably you go to the hospital.
So most of these things are not entirely true.
They're just misconception. They're not true.
Okay, so, and I think I have finally, stress is the main cause of hypertension. How true is that?
Oh, stress cannot be the main cause, because from our definition we have two types of hypertension. Even because it's not yet, even people will tell you that as anxiety, because when you look at stress, anxiety, they all fall together. You can be stressed. They can just impair it. Perhaps they can just trigger it, but they cannot. It's just a short time. This when you spoke about period induced, these are just the whole short time. Before you can be diagnosed with hypertension, there must be, you cannot just come to the clinic a day and say you have hypertension. No, we should have done regular checkup 2 to 3 times before you can be diagnosed. So sometimes when people come with anxiety, stress, all those ones can just be for them time. Once you're done, once you're relieved, the anxiety is up, you'll be fine. So scientists is not yet, or in medical medicine, we've not yet certified that these things, anxiety, stress, and all, can be the cause. And that can lead to, high blood pressure. Because, I mentioned, when I was speaking about the secondary hypertension, I spoke about some kind of medication. So if you're going to manage your stress with medication, you're at risk of developing it. So stress itself will not. But once you start taking medication to feel all right, then you can, just like antidepressant, you can be at risk of developing hypertension.
Okay, so this is my own conception now from what I've heard from you. It might be a misconception, but I'm just going to tell you what I think, what is on my mind right now as you were explaining. So you talked about anxiety, stress. Those are signs of mental health disorders.
No, not really disorder.
So, let's call them mental health challenges.
Yeah.
So could it possibly be that they are somehow intertwined with hypertension, and maybe, just maybe, like I said, my conception, and maybe the situation of the country right now, what people are going through in the world right now, in Africa, in Nigeria, could actually also be part of the reasons why we have 1 in 3 persons being hypertensive. Would you agree with me, or do you think it's just a misconception and that's fine?
No, it's not a misconception. Of course, it can happen that way, but just like the explanation I gave previously, having anxieties and all, but most times it can be short time. But the thing is, when it is not yet scientific proven that this can be a cause, because a lot of people who can have anxiety and all and still not be hypertensive. So, and that's why we've not yet concluded on it.
Okay.
But a lot of persons have raised or elevated blood pressure because of anxiety, because of stress and all. But it's just for a short time. Once you start having to do your normal thing, becomes so fine, it goes back to the normal. But if you're having anxiety or stress and it's leading you up to, that means there's still other factors and not just the stress alone. And that's why that's why we have the elevated, where you have to manage it. And if you're having anxiety or stress and it's leading to you having elevated, because I think most times why people have elevated blood pressure is when they're having all those things. So if lifestyle cannot manage it, at that point it's just beyond. It is not just the distance, because that particular one should be managed.
Right. So you talked about treatment options, and you talked about medications and all. But now medications have become so expensive, and the rising cost of drugs have become a threat to treatment. And as such, people are beginning to die. Some persons can no longer afford it. In fact, I don't think there's affordable medication anymore anywhere. So what can people do, especially those that have to manage hypertension with drugs?
The truth is, it is just very hard. And that's why the education and the preventive measure is there, because if you can get the drugs, because there was a project that was going on. There was I think it started giving out free medication. I think that was why there was so much turn up for it. But after a while, it stopped, and those that cannot afford it stopped coming. The truth of there's nothing. The only thing that can be done if the government decides to make it free, because I was just thinking about something. When you look at HIV medication, hepatitis and also tuberculosis, TB, they are free. So the only thing is, if they can make this medication free, of which I don't know why they've not made it yet, because the only project I know of that was free that stopped at some point, and this medication is very expensive. I think I think in the hospital we didn't have the medication for a while because of the increase the amount, because the people supplying it to and again the time where we are right now, everything is just increasing, because most of this production, they're not even here in Nigeria. They're coming out. Imagine, having to purchase them over and to bring them here. The truth of the matter is, the only thing that can be done is if they should make it free. If not, sincerely, the management control cannot be achieved in that way, because WHO, they're trying to, but the thing is, as long as people don't have money to get it, what will they do? And that's why I think the emphasis has been on the preventive measure, have been on the education to know more about it. So you don't get to the stage where you cannot manage it. I was just feeling for there's some persons that come to us. There's some people I even paid their medication for, they don't have the medication. Do you want me to die? Do you want me to? So the truth is, the management control is just so very poor right now in Nigeria, from the kind of interaction I've had with people. Because not even that, what about people who stay in a very sick location? They don't have even access to even the medication. What happened to them? So the management control still have to fall back to the government if they can do something about it. That's why the people that die more is people with low income community. That is people that die more, because as long as you have your medication, you will fine. So when you start seeing very high death rates, you're seeing it with those country or the states with low income.
In fact, when I saw the number of avoidable deaths, I was like, oh my God.
Yes.
Something needs to be done.
Something needs to be done about it. If not, we cannot manage it properly. Because the only way for you to manage it once it has been discovered or diagnosed is by giving them medication. And once they don't have access to this, so a lot of people want to take but don't have the medication. Imagine getting one at the rate of 1,000 naira or 2,000 naira, and maybe for you that is now at the stage 3, you have to get 3 combination. Imagine buying it.
To get food eat,
again,
taking medication.
We didn't even talk about the healthy living. A lot of people, the reason why they eat what they eat is because they don't have the money. So you see, so it's not like people don't like eating healthy, but once the money is not there, imagine now
can be expensive too.
Imagine. So even the health lifestyle is still there, the food intake. People can just want to cook food and they'll just use salt as let's just use salt to make our restaurant, or because salt is very easy to get. So if we're going to discuss about the management control, it's a whole lot. It's a whole lot, and at that point, it's only the government that can intervene in it. Accept that, because as long as things are very high, it'll be very hard for people to manage, and that's why the deaths keep increasing. Because hypertension, I said earlier, is not a death sentence, but if it's not managed, it can lead to several cardiovascular complications like heart failure, heart stroke, and kidney problem also. And that's why emphasis on the preventive is just so very important, because there's nothing we could do about the management control. All we know is that there are medication. If you want medication, you can come. But it's just the finances now on how to get it. So that's the problem. If not, there are drugs that you can take, and there are a lot of people that have come through. And I think there was a man, there's a patient that came, we started with him with 180, and now his BP is around 140, 130.
Wow.
So it can be managed. So if you see that people are dying from it, it's because of poor education or poor management. Whereas I think the major cause is lack of finances. From my interaction with people, lack of finance, they don't have the money. At times people beg, please give me, please. You start you as a person responding to them, you start having to pay for their medication, or which is not always you have the finance. Imagine 20 people coming to ask you to pay for their medication. So, and that's where it's just so sad that the government have to intervene if they can make it free. I don't know why they are not making it free. I don't know myself.
Maybe because there are lots of other health issues that are calling for that kind of attention. Imagine diabetes as well is something
diabetes
also calling
medication.
For attention.
So much.
But we just hope that something is done.
Yes.
But in the meantime, I want you to please reiterate some of the preventive measures so people don't find themselves in that situation. Of please help me pay for medication that I can no longer afford.
True. So part of the preventive measure, because it can be prevented, even if, just like I said earlier, even if there's a family history, do not mean you will have it if you will manage and control. And one of these is reduce the uptake of salt. That is when it comes to a healthy lifestyle. The uptake of whatever you're eating, reduce the salt. You don't have to put all the salt And again, processed food. You know, when you check the label of most of this processed, you can see that most of them contain high sodium. They might not put salt there. So what you say is sodium. So a lot of people that don't know that sodium can contain, you can say sodium in salt. So people don't know. So a lot of this processed canned food, you know, people think, okay, it is foreign. It's no. These things, it's better for you to get your fresh food and cook it. It's because a lot of things have high content of salt inside. So reduction of salt, if you can do it, just do it. And that's why people are at risk. You see someone can just wake up and there's no why are you having it? And again, go for regular checkup to cholesterol, check your cholesterol level, and avoid fatty food because it can build up fatty tissues in your blood walls, which can, if it's ruptured, it can lead to blood clots. It can lead to low supply of blood to the brain, and that is death sentence. And again, regular exercise is very important. That is one preventive measure. Regular exercise. Okay. Go for exercise. You can just jump, you know. It doesn't have to be so strenuous exercise. You can just wake up. You know, sometimes in my house, you know, my family were laughing. I would just wake up and jump, you know, push myself around. Don't sit for too long.
Oh, sorry to cut you there, because when you talk about regular exercise, in my head, I'm like, if you exercise too much, won't you already overwork your heart?
I think I'm going to talk about that first.
Okay.
I'm going to talk about that, but we should talk about the preventive measure. That's why there are different type of exercise. There are cardiovascular exercise,
okay,
but we'll go to there. We'll go back to there. Okay. And so we're talking about preventive, you know, regular exercise. That's for those who don't, because this preventive measure now is for those who have not yet developed it. So regular exercise, especially when you know that you're older, you're already older, you should know that, okay, I'm at this age, I'm likely to have this, I'm predisposed to this illness and all. You go for a regular exercise and avoid medication that are not being prescribed. Yeah. Avoid most of this. There's this non-drugs. There's this, you know, there's so many painkillers people take. Do not just take drugs because you know the name of the drugs or because you're feeling headache. No, true. Most of these drugs can also lead. Yes, most of the time when you see the side effect of the drug, you will run from them. It's just that people don't know the side effects. And as I said, someone is swallowing paracetamol every second. Yeah. Or you have headache, you're swallowing. Or you're stressed. The times where you have headache, just sleep, drink water and sleep. Well, so most of this, so reduction of most of this medication, and again, reduce alcohol. If you want to celebrate, it's fine, but you know your health is more important. Absolutely. So there should be reduction. Uptake of alcohol. Then, of course, you know, we're talking about cardiovascular. For those who are already hypertensive, when we speak about exercise, we're not telling you to leave gym. Don't even try that. Okay. You're going to overwork the heart.
So whilst you answer that, because we're winding down now, we're rounding up. So whilst you answer that, I would also love you to use the opportunity to advise our viewers, those who already have it, your final words to them. Okay, no problem. So as you're speaking, for those who already have, for those who are hypertensive, when we speak about exercise, we're not taking to do a very strenuous exercise. All we want to just walk. Don't sit for too long, because sitting for too long can put you at risk. You can just walk from one location to another. You can just jump a little bit. You can just walk a little bit. You can skip. Those are the exercises. We're not telling you to leave gym. Don't even try that. Do not, because that can actually even put you at more risk of developing that. And so for viewers out there, we've seen that there's so much risk and so much complication that can come with hypertension. So there's so much risks that can come with having hypertension. So for those who are not yet hypertensive, it is of most important that we go for a regular checkup, because the only way you can know that you're hypertensive is that you go for a regular checkup. And again, eat healthy diet. Yeah. Eat good food. Reduce your uptake of salt. Reduce alcohol, because those are the things that can put you at risk. And also go for regular exercise. You don't have to run out. You don't have to go to the gym. But even in your house, you can get your exercise done. So these things can, you know, can limit you or can help you to shield you from, you know, developing hypertension. And those who already have it, the thing is that it is not a death sentence. You're not going to die because you have hypertension. The only thing is that you only die if you don't manage it. You can only have complication if it's not well managed. But as long as you're managing it, you're fine. Hypertension is not a death sentence. It can be managed and it can be controlled. If you know that you've been diagnosed, it is so important that you visit your nearest clinic for medication or healthy lifestyle. So with this, you can be fine.
hypertension, it is not a death sentence. So I just want to leave you with this, that hypertension is not a death sentence. It can be managed and it can be controlled. Thank you.
Thank you so much, medical physiologist Grace Okwa Ogilegwu. Thank you so much for your time today.
Thank you for having me.
All right, viewers, I'm sure you've learned a thing or two. In fact, I am very, very informed. I do not know about you, but at least now I know better that hypertension is not a death sentence if we actually manage it properly. I'll see you again next week. I am Olamide Alhassan, and bye for now.